Good morning, everybody. If I can have your attention, please. Thank you very much. Please welcome President of Harvard Healthcare Fairfield Region, Vince DiBattista.
I wish I could command a room like that. So I want to thank everyone for coming and welcome to our official opening of the Connecticut Orthopedic Institute at St. Vincent's Medical Center. As is our tradition, we'd like to start with a reflection, and Bill Holy, would you please do us the honors?
Good morning.
Good morning.
We could all just take a moment and quiet our minds and our hearts. Driving to the medical center this morning, we were treated to a magnificent sunrise. How appropriate for this day when we formally open this sacred space of healing for those we are blessed to treat. We are excited to shine a light on this amazing new endeavor, the Connecticut Orthopedic Institute at St. Vincent's. We are grateful for all who have played a role in bringing this state-of-the-art institute to life. The senior leadership of Hartford Healthcare, the architects, the construction workers, the clinical leaders, the housekeepers, the doctors, nurses, and all those who will provide healing to the patients entrusted to our care. This is an important day in the history of Hartford Healthcare as it expands its offering at St. Vincent's and the Fairfield region. May all who are treated here feel that we have done the kind thing for them. May they feel that we have done the safe thing for them. May they feel we have done the best thing for them. And may they feel that we have done the right thing for them. We ask all this in the name of all that is holy. Amen.
Amen.
Thank you, Bill. So part of our goal with the affiliation of St. Vincent's and Hartford Healthcare was to make this hospital a tertiary care destination center. A lot of people over the past year have asked, how are we going to take the community hospital and make it a center where folks in Fairfield County will want to stay here for their complex care? And the answer is simple. It's more than just changing the physical plan, although this is important. It's bringing in top doctors coupled with trained and dedicated support staff and a vision of providing a constant, superb experience for the patient. It also requires the leadership of Adonna Sassy and Andrew Terzak and their exceptional support team, working in tandem with our great physician leaders, and you'll hear two of them later, in Drs. Gerard and Irving. Our partnership with Connecticut Orthopedic Specialists, Ortho Connecticut, and the Orthopedic Specialty Group has allowed us to affiliate with some of the premier orthopedic surgeons in Fairfield County, and most importantly, a group that shares our vision of patient-centered care. I'm proud of what each person has contributed. There's just so many to thank, but each person has played an important role in getting this institute off the ground. It's been an honor to build this institute with each of you. I'd like to now introduce you to Jeffrey Flax, our President and Chief Executive Officer of Hartford Healthcare.
Thank you. Good morning. I could not be more excited about today. This is a momentous day. This is an important day. We have a vision, and we have a vision within St. Vincent's, within Fairfield County, to create world-class capabilities, to create a destination healthcare system, and it's happening. And our vision is predicated on access, expertise, and community. And we're building those capabilities into our culture within this system. When we look at our health system today in orthopedics across Connecticut, we are amongst not only the leaders across the Northeast, but across the country. Today within Connecticut, 1/3 of the joint replacements occur within Hartford Healthcare facilities. 1/2 of the spine surgeries occur within Hartford Healthcare facilities. We're building a level of expertise that is world-class. And that's what our vision is. And the facilities are important, the technology is important, but what makes our programs great are the people and the culture and the commitment that we have to excellence and to quality. And the quality of this institution will speak for itself. We will be transparent, we will have the data, we will demonstrate our research, and we will be able to show the efficacy of our care, the affordability of our care, and the access to the care that we create here in Fairfield in the Connecticut Orthopedic Institute. So I really couldn't be more excited. When we see already the results that are occurring in terms of the levels of patient experience, patient satisfaction, the efficiency of the care we're providing in terms of the length of stay, we're making enormous progress. And we're going to continue to invest, challenge, innovate, push our teams forward to truly delivering the very best care, the most emerging, innovative care that can be done within this region. So this is a great moment for us. And it really is built upon having people who buy into this vision, who lead this vision. So we're really grateful to Drs. Jack Irving and Dr. Gerard, who have stepped forward and who have helped us lead and evolve the vision of which we're creating here. We're grateful for all of the partners who've worked with us. Certainly Donna Sassy and Andy Churzak, who've worked across Hartford Healthcare and building our orthopedic institutes. It's absolutely critical to have people who help create this culture, which is so essential. So as we come together today, this is just the beginning. It's just the beginning. There are so many programs that are expanding here. There's so much talent that is joining us within this region that I know as we go forward, we're going to look back at today in a very celebratory fashion, but we're going to see this actually in many ways as the floor. It's not by any means the ceiling, because what's happening is something very special. And we're bringing tremendously talented physicians and providers here to this campus, and together they are creating truly world-class care. So I'm very happy to introduce Drs. Irving and Dr. Gerard to further elaborate on this vision and what we're creating. And I just want to congratulate everyone who contributed to building this system of care here in Fairfield County, and who will continue to help us create the next level as we go forward. So thank you so much.
Thank you, Jeff. It's been an incredible journey for us. Together, we have built an unsurpassed facility and experience for our patients and our surgeons. The Connecticut Orthopedic Institute provides comprehensive, coordinated care. Today, I'd like to share with you a snapshot of what that looks like. The morning of surgery, our patients come into the hospital and are registered in a private 2,700 square foot galleria that boasts a private waiting area and individualized consultation rooms. A state-of-the-art text paging system allows our teams to connect with the family members who are waiting to let them know when the surgery is completed. At that time, the staff escort them into the private consultation rooms to meet with the surgeons. After surgery, our patients continue their recovery on a 30,000 square foot inpatient unit that was newly renovated. We designated the inpatient infrastructure to support healing. This unit has been designed with 35 private rooms and large bathrooms and various amenities. One of the amenities includes a private kitchen. Patients are served breakfast early in the morning to have them ready for the rehab class. Classes are held in a private gym located on the unit. The care we provide does not stop when the patient is discharged. The patient is followed in 90 days. Our orthopedic navigators are sure that those touch points happen and that our patients' needs are met. Our facility enhancements have added a tremendous amount to the Institute, but it is the fundamentals and the focus on our patients that make us the patient and provider choice for care. I would like to thank Andrew Turchik, the Director of Operations, for his leadership, and also the multidisciplinary teams that work together every day to assure that we deliver superior coordinated care. Thank you. At this time, I'd like to introduce Dr. Jack Irving, the Co-Medical Director of the Connecticut Orthopedic Institute.
Good morning, everybody. Thank you, Donna, and thank you to everybody here that contributed to the success of this day. It's a great day. What's made the partnership with Hartford Healthcare unique is the opportunity for us as physicians to work closely with administration, hospital leadership, and other staff members to bring us a unified, comprehensive center, as you have heard. We work together to design and build a first-class new orthopedic destination here in Fairfield County. The collaboration that we have seen is absolutely unsurpassed in any facility, and it's certainly contributed to an increase in patient satisfaction, patient safety, and to our patient outcomes, as you'll hear in just a minute. The integration of physician and staff ideas into creating this healthful and rehabilitative environment has actually gone to focus on a true patient-oriented care program. We have had some recent excellent feedback and comments from patients, and I'd like to share some of those with you right now. One patient we recently heard of said it was like staying in a five-star hotel. Another said everyone from nurses to the food service staff was fabulous, kind personality. I will never go back to another hospital. Another said I felt more safe, comfortable, and cared for. Great communication with all the staff members, exceptional coordination among caregivers, and finally, the caring individuals who help, from the nurses to the CNAs to the physical therapists to the occupational therapists in the gym. I feel like I hit the jackpot. Those are quotes from patients. I feel like I hit the jackpot. This is a great team, a great facility. I look forward to continuing to build this excellent reputation. And again, thank you to all for your continued dedication and your commitment to Connecticut Orthopedic Institute. And with that, I'd like to introduce my co-director, Dr. Gerard.
We wear name tags because people find us, they're hard to tell us apart. Good morning, it's a real pleasure. Wow, I can't believe we're here. I've been part of the medical staff at St. Vincent's for over 25 years. I wanted to say decades, but I thought that was a little antiquated. And I've worked with great colleagues and coworkers, but it's no great secret that St. Vincent's ran into tough times a couple of years ago. But it had nothing to do with the people that work here. It had more to do with lack of leadership and lack of resources. Myself and several other doctors lobbied when St. Vincent's was coming up for sale to have Hartford Health purchase it because we saw what they did at their other institutes, and it was amazing. And they've lived up to that. Every design and detail in this institute has been very carefully reviewed, researched, debated, practiced, and refined. And it was a collaborative effort. My colleagues here that you met from the other groups, we worked very hard to create Connecticut Orthopedic Institute. Our staff is certified in orthopedics and soon will be certified in spine, so we assure that we deliver the utmost care. Our frontline staff, physicians, physical therapists, PAs, dietary and environmental services have all come together and formed this family to deliver us to a better and even higher level of orthopedic care. We've taken a very modern approach to our treatment of spine, unique in that no other hospital has, that we have the Connecticut Orthopedic Institute along with the Ayer Neuroscience have come together to bring both worlds of ortho and neuro together to make one. And with this collection of talented surgeons, we can make this a center of spinal excellence. But it doesn't stop there. We could say all these nice things, and like Jeff Flax said, this is the basement, we gotta work. We have a lot of benchmarks to hit. But one of the things that came out in the recent past that we've already exceeded is that patient satisfaction, which for somebody that's been part of St. Vincent for so long, really never existed, is one of the tops in the state. And what comes with that, and I think they're hand in hand, is employee satisfaction. And I never experienced that at St. Vincent's. Now I'm experiencing every day from every facet. So we'll continue to make this a center of excellence. It's been a pleasure to work with my colleagues. I want to personally thank Jeff Flax and the leadership at Hartford that's given all of us the ability and the resources to make Connecticut Orthopedics. And I think we're going to become, and I know we're going to become, a center of excellence and a destination hospital. Thank you.
Wow. Gerard, thank you. Jack, Donna, Andrew, just truly exceptional work. I do want to close by thanking all of our associates and physicians. I'm most proud that as we focused on building a strong healthcare delivery system in this past year, that we did not allow COVID to dictate our destiny. Staff and providers each day have risen to new levels of greatness and inspiration. I know it has been difficult, and much has been sacrificed, but your efforts will never be forgotten by any of us. So I thank you again. Now, can we get some of that talented surgical group to see if we can cut a ribbon here?
That's good, guys. That's good. That's good. That's good. Yeah. Oh, I'm plugged out.
I can only see just the wire ribbon itself. So, all right, I'm gonna have to go up a little.
Hold on.
Okay, I can get everybody.
Not yet. Not yet.
No, Vince, can I have you? Yeah, I want Vince here, please.
All right, Chris, get my money for that.
Not really.
I'm ready. Are you guys ready?
I'm ready.
Is everybody ready? Okay.
I got everybody.
You ready?
Nick.
Nick. It's okay. I was like, who is that?
It's like, this is for the commercial, so
I know.
everybody else is gonna have
it was just like all of a sudden.
my hand came. Sorry. What's that? Oh, no. I didn't know I was that close.
No, you backed out before.
Just before he cut it, I was like, ah! Okay, cool.